Hello, my name is Dr. Coring. I'm an internal medicine physician by training. However, I'm also a hematology oncology fellow. And so I have extensive experience with internal medicine, medical conditions overall. And therefore, I want to be able to use my knowledge as well as my skills to create a space, create a platform that I'm able to educate ordinary people, essentially people like yourself. Educating patients is a passion for me. I intend to improve health literacy, and so that's why I started this channel. And what I plan on doing is discussing various health topics, things I see and treat pretty much on a daily basis, as well as do some basically health prevention and discuss those topics as well. My plan is to do a 10-minute topic periodically, frequently, and that way, I plan on making our community more health literate. And so today, my topic is on iron deficiency anemia. What I plan on doing today is discussing what is iron deficiency anemia, also discussing the risk factor of iron deficiency anemia, the symptoms that you can expect if you have iron deficiency anemia, how to diagnose it. How do we diagnose iron deficiency anemia? I plan on to discuss how we treat iron deficiency anemia and how can we prevent iron deficiency anemia. So let's get started. What is iron deficiency anemia? Well, we typically separate the diagnosis into two parts. One part is iron deficiency, and then the next part is iron deficiency anemia. Iron deficiency anemia happens when iron deficiency becomes a problem, so much so that your body becomes anemic. And so, what does that mean? Anemia means that you have low hemoglobin. And hemoglobin is a protein that's located inside of red blood cells. And hemoglobin's job is to acquire oxygen and transport oxygen to our tissues. And so we become anemic when the hemoglobin, specifically for women, gets below 12, and the hemoglobin specifically for men gets below 13.5. That's essentially the definition of anemia. Now, how does iron play a role in anemia? Well, it turns out that the RBCs, the red blood cells, need the elemental iron to manufacture itself. And so the body uses iron in order to produce and manufacture red blood cells. And if iron is deficient, or if you lack iron, then you will lack red blood cells. And if you lack red blood cells, then you will become anemic. Essentially, you have the potential of becoming anemic. And so it's oftentimes where we diagnose a patient with anemia just by doing a simple blood draw, getting the CBC, and we see the hemoglobin is low. And then the next question we ask ourselves is why? Why is this person anemic? And so we typically do an iron panel and an iron deficiency workup, and that's how we make the diagnosis by looking at more studies other than the hemoglobin. We look at ferritin, we look at your iron levels, we look at the total iron binding capacity as well. And so we use all of these precursors to make the diagnosis. So that's the definition. Now, what are the risk factors of iron deficiency anemia? The primary risk factor is blood loss. Losing blood put you at risk of iron deficiency anemia. Also, another risk factor for iron deficiency anemia is poor absorption. Maybe you can't absorb the iron. Iron is typically absorbed within the GI tract. And if you have any problems with your GI tract, then that iron deficiency can also become a problem. Also, diet. Are you getting enough iron in your diet? And so that's also a risk factor. Not eating enough products that contain iron, specifically meats. And so those are your risk factors. Diet, poor absorption, for whatever reason, you're not absorbing the iron in your body. And then also blood loss, losing blood. Now, what are the symptoms of iron deficiency anemia? So people often complain of fatigue. That's the main symptom. Exercise intolerability, not being able to finish your workout. That's very common. So we get that a lot. Also, people notice that they're craving weird things. We call that pica. So people could crave weird substances like clay, paper. Also, people crave ice. It's very typical. I remember my mom, she used to go to it's a restaurant called Rallies. Now I think it's called Checkers. But they have this crunch slushy type ice. I remember oftentimes she would pick me up from school, go through Rallies, drive through, and just order ice. That's it. And it turns out she was anemic because she had high menstrual periods. And so losing blood, like I mentioned before, that's a primary risk factor. And for women, going back to risk factors, losing blood through uh, the vaginal vault, mainly through menstruation, put you at risk for iron deficiency anemia. Also, we worry about losing blood through the GI tract. And so it's oftentimes, going back to risk factors, there is oftentimes where a man or woman over the age of 50 would present with these symptoms: fatigue, exercise intolerance. We find them to be actually anemic, and then later find to be iron deficient. And they're saying that they're bleeding through the GI tract. They're having, when they wipe, they're seeing bright red blood on the napkin when they're wiping, and that makes us worried for cancer, essentially colorectal cancer. So an indication to get screened for colorectal cancer is iron deficiency anemia in adults, specifically adults over the age of 45 if you're African American and 50 if you're not. And so I just wanted to bring that awareness. And so we talk about the primary symptoms: fatigue, pica, restless leg syndrome. Basically you're sitting down, especially at night, your legs just have numbness, tingling. You have to move your legs in order to relieve just weird sensations in your legs. We call that restless leg syndrome. And restless leg syndrome is a symptom of iron deficiency anemia. So if you have this, you may want to get screened for iron deficiency anemia. But definitely, by far, fatigue is the most prevalent sign and symptom. Shortness of breath, people get tachycardic palpitations. Those things happen as well. I talked about briefly how we diagnose this. Basically, it's a few blood draws. Initially, we would do one blood draw to see that you're actually anemic by looking at your hemoglobin. Then we would do more blood draws to diagnose iron deficiency anemia with other tests. And if you're complaining of GI symptoms, mainly GI bleeding, we may more than likely refer you to gastroenterology for endoscopy, mainly a colonoscopy, because that is an indication for a colonoscopy. Now, how do we treat this? So once you're diagnosed, how do we treat this? Well, the first thing we want to do is make sure there's no underlying issue. And so we would do the colonoscopy if you're complaining of GI bleeding. And we also will assess your menstruation history if you're a woman. And, maybe it's you're menstruating. And if you are menstruating heavily, that's an indication to treat the iron deficiency anemia, because you're losing a lot of iron through the blood, passing the blood. And so how do we treat? Well, iron deficiency anemia can be treated easily with over-the-counter iron supplements. We get these iron supplements, as mentioned, over-the-counter. They come in many different formulations, from solid pill formulations all the way to liquid formulations. Typically, you just find a formulation that works for you. All you need to do is take the iron supplement one time a day, every other day, mainly 3 days out of the week. That's all there is to it, really. And you should see improvement within 6 to 8 weeks. So the hemoglobin typically takes 6 to 8 weeks to improve. Your symptoms should also start to resolve, as well as we starting to treat the iron deficiency. But understand, everybody can't tolerate the pills. So therefore, we go to IV treatment. And IV iron infusions is very common in people who can't tolerate the pills. Now you may ask, why can't why would somebody not be able to tolerate iron pills? Well, iron pills can cause a lot of gastrointestinal side effects, mainly constipation. And so therefore we tell people, hey, if you're experiencing constipation, maybe you should take a stool softener and a stimulant. So Dr. Senna is my favorite go-to that I like to prescribe. Also, vitamin C can also help with the absorption. So the reason why we worry about that because some formulations are not well absorbed. So maybe you taking the iron pills, not getting a lot of side effects, and then we actually repeat the lab draw maybe a month later and realize you're not improving. Your hemoglobin is not improving, and also your iron levels aren't improving. Then we were worried that maybe you're not absorbing the iron pills as you should, and so that's when we recommend vitamin C orange juice, which contains a lot of vitamin C to help with absorption. But I already empirically tell patients, hey, just go ahead and if you're going to take the iron supplements, just take a vitamin C or drink some orange juice with it to help to ensure the absorption. So if you have absorption issues, we can fix that. If you just can't tolerate it because of the constipation, you try stool softeners, you may have to go to the IV iron route. IV iron infusions will be the next step. Some people come in barely severely iron deficient. The hemoglobin is really low and the iron levels are really low. And those people, we automatically just go ahead and refer them to an iron infusion center to get the iron infusion. You do this once weekly until your iron levels and your hemoglobin improve, and then you could do it periodically from there. The last thing I would like to discuss, I know I'm a little bit over my time, but the last thing I would like to discuss is screening. When and do we screen for iron deficiency anemia? And I think it's appropriate to screen for iron deficiency anemia, mainly, with our pregnant patients. So people who are pregnant, it's appropriate to maybe screen, do a CBC, look at the hemoglobin, see if they're iron deficient. We can easily prescribe iron pills for that patient population, but typically we don't really screen for iron deficiency anemia other than that indication. And, things, again, I want to leave with the things we worry about with this disease specifically. If somebody presents with iron deficiency anemia, is colorectal cancer. That's the primary thing. So my take-home message here is that if you do have iron deficiency anemia, especially if you're a man or if you're a woman, postmenopausal woman with iron deficiency anemia, then I think it's prudent that you talk to your healthcare provider to understand why you have iron deficiency, and to make sure that it's not because you have a colorectal cancer. If that's the case, you may need to be screened with an endoscopy. That's my time. That's all I have. Thank you for listening. It's my pleasure to do these talks and these discussions. I'm looking forward to the next discussion. So again, this is Dr. Coring, internal medicine physician. Very nice to be here with you guys to discuss iron deficiency anemia. Peace and love, and looking forward to the next session. Bye.